Hi Professor, hope all of you are doing well and been having a great time. Now this time me Nasser presenting a review of blockchain implementation in health information network with security and privacy. Blockchain technology is an open, decentralized, distributed ledger that produces an immutable block of transactions. It is currently the most stable with no allegations of hacks and robust security provided by numerous block copies on multiple nodes. No system is completely secure and can be compromised by malicious hackers. In this project work, I explore what happening with blockchain technology, security, privacy, newest applications, and the adoption trends in business and research. I focused on the process of implementation of blockchain technology in health information network in brief hint with the security and privacy aspects, and finally reviewed the challenges of blockchain framework and overcome processes in health information network as well. The remainder of this presentation is organized as this outline: introduction, some preliminaries, blockchain implementation in health information network, security and privacy review of blockchain in health information network, thoughts and remarks with some challenges, and conclusion. The patient's health information is crucial to a rapid and effective diagnosis. It includes physician prescriptions, treatment plans, test results, immunization report, mental behavior, and more. There are two kinds of health information for recording medical history: electronic health records and personal health records, or personal health data or personal health information. Integrity of the data and privacy cannot be guaranteed by the centralized databases, so we can use blockchain to develop a new method for exchanging information. A blockchain-based solution will offer information security, dependability, data privacy, system redundancy, and interoperability. Before I explain and discuss how blockchain works in health information network, let's assume that we have some preliminary knowledge of blockchain like node and mining, proof of work, public or permissionless blockchain, enterprise or permission blockchain, hybrid blockchain. Though I quickly reviewing the key ideas and terminologies related to the proposed review work. So we can ask, what is blockchain? In simply, we can say a chain of data or transactions is described as blocks linked or chained together by cryptographic signature is called blockchain. Blockchain is a peer-to-peer distributed and decentralized ledger technology where every transaction written in shared public ledger which is open for all. There is an acute difference between decentralized and distributed ledger. All decentralized ledger is a distributed ledger, but all distributed ledger is not a decentralized. Here, private blockchain is not a fully distributed system. Therefore, blockchain technology must comprise of either fully or partially distributed ledger and decentralized ledger. Node is a computer or application-specific integrated circuit machine. These nodes owned by a miner. In fact, mining means to give an authorization by examining a transaction and adding this transaction in a new block in blockchain. Each block has a timestamp. In figure 1, we see blocks are linked together and using this hash of the preceding block. Consensus rule is a consent of maximum node, that is 51%. It is a dynamic process for a community to come to a consensus. Different consensus methods are used by different platform implementations. Here are several examples: proof of work, proof of stake, proof of importance, etc. Now come to the questions of what is health information network and smart contract. Canada Health Info created the term health information network from Health Information Exchange, and smart contracts are blockchain-based programs or protocol that are performed by all nodes on the network. In fact, smart contracts will eventually eliminate the need for human lawyers. Yes, it's true. Before blockchain implementation in health information network, we need to understand how blockchain framework works. So for this reason, I chose a simulation tool named BlockSIM. In the project report in appendix where I have discussed the mechanism of blockchain to understand the technique that makes blockchain systems function and how it works in health information network. Before moving on, we have to clarify these considerations of some questions such as what should think about while developing blockchain solutions for health information network. Due to the time limitation in this presentation, I just can answer that what are the main technical things developing blockchain in health information network. These are standardization, adoption, and incentives for participation, balancing transaction volume and available computing power and operational expenses. And this blockchain in health information network can be used in three main areas: organizing data from electronic medical record, electronic health record, and personal health record; data security in the health information network; data management on personal health record. Now moving on how blockchain works in health information network. There are two types implementation: on-premise blockchain and cloud-based blockchain. Any smart contract-based blockchain framework like Ethereum can be applied in health information network, either patient-driven or institution-driven. This framework can be developed using Solidity, the Ethereum blockchain's program language. In figure 2, there are explanations how Ethereum blockchain works in health information network using smart contracts in the 5 stages. Stage 1 is make use of the public hash key to replace the patient's identity. The patient's identity is replaced with this hash. When a user's identification is replaced by a hash, hackers are unable to decrypt the identities of secured medical information like electronic health record or protected health information. De-identification removes details such as the patient's name, sex, age, previous medical history, and diagnostic results, medications, etc. Stage 2 is make the information to be PIPEDA compliant. The concerned parties may only obtain and share non-identifiable information according to PIPEDA's privacy regulations. Step 3 is store information on the blockchain and transactions get executed with unique identifier. When healthcare providers offer services to patients, all of the healthcare information is stored on the blockchain using a public key. Patient's address, financial details, and other information are all stored in the blockchain. By activating smart contracts, health suppliers, caregivers, and health insurer may record information in the form of transactions on the blockchain. If a healthcare practitioner requires access to a patient's public record, the data is only presented once the transaction ID is verified. Step 4 is healthcare organizations generate a query to the blockchain. API allow healthcare provider and public health organizations to generate and submit inquiries. At this point, smart contracts make non-identifiable data like age, sex, and other demographics available data. Step 5 is patient shares the public-private key with healthcare sector provider. Patients' public keys are directly connected to blockchain records. Patients' data becomes accessible when they exchange their public or private keys with healthcare sector provider. When it comes to information storage, blockchain can be used as a transaction layer in two manners: on chain and off chain. In on chain, data is kept directly on the blockchain. In this case, for example, hashed codes, transactions record, audit data, and metadata regarding off-chain storage. In off-chain, information is stored off-chain and connected to the blockchain. These connections serve as pointers to record stored in traditional databases. For example, blockchain cannot hold abstract data such as X-ray and magnetic resonance imaging. Blockchain in healthcare service provider is primarily used to address data integrity, interoperability, and data privacy in existing electronic health records. If a healthcare provider protects client device access but leaves the network, servers, or storage unsecured, hackers will simply move their focus away from client devices to other more readily exploitable parts of the IT network chain. There are some tactics and security measures I am going to discuss in short for adopting and reducing risk with the health information network blockchain. Here, securing the health information network is a top priority. Now come to the blockchain privacy. Privacy is essential to health information network. While a promising blockchain technology to protect privacy of protected health information is being used in healthcare. Here I tried to explain in brief in figure 3 about health information networks blockchain's privacy. The life cycle of data privacy is a process that involves the collecting, usage, storing, sharing, and destruction of personal information. Some rules and laws limit data independence and cross-border data movement. One such example is if a blockchain with nodes in Canada is used to store personally identifiable information of Canadian residents, and additional blockchain nodes are subsequently added in the United States, then resulting in the transfer of all the data in that blockchain network to preserve consistency and validity of the ledgers. Moving on remarks and challenges, blockchain is a distributed and decentralized technology, but not a distributed computing system. Blockchain's data is immutable and sometimes inefficient. Scalability and sustainability are some issues, need expertise knowledge, and suffers from interoperability. As illustrated in figure 4, the main blockchain difficulties are processing power, storage, and scalability. In health information network, blockchain needs managing the relationship between transaction volume and available processing power. In a broad sense, health information network blockchain will include just the bare minimum of data sufficient to enable the desired use cases, but other than that minimum to reduce the previously stated list of issues. When it comes to healthcare, data sharing, data security, and privacy are important concerns. Some of the most important difficulties connected with health information networks are listed here in these slides. Last of all, blockchain technology is not a panacea for data standards and integration. Nonetheless, it offers a secure distributed architecture for enhancing healthcare data sharing across a variety of consumers and providers. In this project paper, I explored how blockchain technology may benefit healthcare service provider and electronic health record. Despite advancement in medical organizations and electronic health record system, certain problems remain that this blockchain solved. This project reviews blockchain deployment in health information networks with security and privacy and summarizes its main concepts and challenges and solutions. The blockchain security characteristics may significantly improve the security of medical data due to its increased clarity, security, and ease of access to data. Blockchain has the potential to bring about significant improvements in the safety and quality of vaccinations, pharmaceuticals, diagnostics, and treatment process. Last of all, blockchain is not a utopia or single solution that will solve all the world's interoperability problems. In healthcare, blockchain will not replace any databases, rather it will serve as a business-to-business middleware. However, blockchain technology has the potentiality to make a big difference in terms of increasing health information network interoperability. We should utilize the blockchain technology perfectly in healthcare information network. So these are the reference of the topic I used. So that's the end of my today's presentation. If you have any questions, please ask me and comment me or email me. I will try to answer all your questions. Thank you.